A very good afternoon and welcome to our session on topic Recurrent Implantation Failure. We are glad to have Dr. Garima Sharma among us today to help us understand the topic. The doctor will take us through that and more in the session today. Doctor, you have the stage.
Thank you. And after a long Diwali vacation, I think we are back today with another important, but at the same time, a little upsetting and a little frustrating topic, which is called as a recurrent implantation failure. So, as the name suggests, each and every word has in itself is self-explanatory. Recurrent is that is again and again you are facing difficulties when it comes to the implantation of the embryo and you're not able to see a successful pregnancy. Now, in our scientific terms, whom do we really label as a couple with recurrent implantation failure? Well, there are broad definitions, there is not a common consensus, but still, we say that if you have undergone two or three good attempts of an embryo transfer with a good quality embryos which have been graded through your microscope by your embryologist on a uterus with a very good optimal uterus lining and still you're not able to achieve pregnancy, then we suspect that somewhere the implantation is going on a toss and this couple is labeled as a couple facing recurrent implantation failure issues. Well, before we embark onto an IVF journey, every couple comes to us with a question, Doctor, what is the success rate of an IVF? And that is also where we tell them very clearly that across the globe, wherever they might go, IVF cannot give you or guarantee you a 100% success rate. Now, IVF success rate, of course, I'm not getting into that because that's not my topic, but IVF success is dependent on a lot of factors. And even if you have been able to achieve a good quality embryo that you have graded on a microscope, even when you have a good uterus lining, the maximum success rate would vary between 40 to 60%, depending on other parameters also. And therefore, the implantation is one parameter which is not controlled by the medical science. Basically, there's no glue that you can put it on the embryo and tell that embryo go and stick to the mother's womb. But however, having said that, if you have been a couple who has faced this kind of an issue with good two or three embryo transfers and not no success rate, rather than jumping on to the next round of either an IVF or an embryo transfer, it is very, very important to review your papers. Think of some advanced parameters or advanced tests which could be going on a toss and which are preventing you from this positive pregnancy journey. So, when I talk about the possibilities or possible causes of a recurrent implantation failure, of course, the first suspicion goes on to whether it could be a genetic abnormality in the embryo. Second, it could be the problem within the uterus, that is, the uterus is just not receptive to take care of the embryo. It could be a combination, that is, problems with the uterus and the embryo. It could be certain other factors which, like your adenomyosis or your fibroids or your endometriosis, which we thought of that yes, they are present, but they might not prevent us from pregnancy, and therefore we did not remove them surgically. But now you could think that they are preventing you from getting pregnant. And the last of all would be an unexplained, that you have tested everything, but still you are not able to achieve positive pregnancy. There are certain possible mechanisms that are beyond the scope of our testing, and that is preventing you from pregnancy. So, well, when I talk about these broader four categories, I'm going to talk about each of them now individually, that what I really mean to say by each of these terms that I have used, what can we do to optimize our pregnancy. So when I said the embryo quality, now when you go to your doctor after an IVF, your doctor generally tells you that we have X number of day 3 embryos, we have X number of day 5 or blastocysts. This is the quality, grade A, grade B, grade C. Now you have to understand that this quality and this grading has been assessed based on the appearance of an embryo on a microscope by the embryologist. Now, there are clear cut guidelines across the globe which have given us, okay, this is a good quality embryo, this is a moderate quality, and this is not so good quality of embryo. But what we do not know from this is what is the genetic makeup of this embryo. So, in case yeah, we have seen that there's a good quality blastocyst, but this couple might have issues with an advanced female age, or where the egg reserve was low, or where we were dealing with the sperm factor. There has been a history of repeated miscarriages in the past. There can be a possibility that the make of the embryo is genetically abnormal. So, in certain situations, before going ahead with the next embryo transfer, you can think of doing a pre implantation genetic testing. That is, before you transfer the embryo, you are doing the DNA analysis, you are doing the genetic testing of this embryo to look out for any kind of an abnormality. Now, what is very important for you to understand that when you are doing the pre-implantation genetic testing, you get to know these are genetically normal embryos and these are genetically abnormal embryos. But it does not mean that you are getting 100% pregnancy success. What you are able to achieve is that the implantation failure because of a genetically abnormal embryo or repeated miscarriages or genetically abnormal child, all these parameters are taken care of. The second thing or the second suspicion goes to whether there is an abnormality in the receptivity of the uterus. So, what I mean to say is, again, when you go to your doctor, you have seen that timing of the embryo transfer is so crucial. So, if it's a day 5 embryo, we generally give you 5 days of a progesterone and then schedule the transfer. If it's a day 3 embryo, we give you 3 days of a progesterone and then schedule the transfer. It is not like an erratic thing. You can give your progesterone as per your choice and then plan an embryo transfer as per your convenience. This is because if you go by a natural cycle, once a female ovulates, it is generally from the fifth or the sixth day of the ovulation that if she's getting pregnant, that is the day when the embryo will come and implant in the uterus. Now, for some females, this window of implantation that we call can shift by 1 day prior, 1 day later, 2 days prior, 2 days later, and therefore that could also be a challenge and could give you a situation like an implantation failure. So tests like endometrial receptivity array or assay, these are advanced tests which basically look into the receptivity of the endometrium, give us a clear-cut clue what is the window of implantation, and then you can plan your embryo transfer as per the implantation window that you have. The third factor, which I said, was miscellaneous factors. Now you get a good detailed 3D sonography and you try to look out for factors like hydrosalpinx, which is the presence of a fluid within the fallopian tubes, or a big significant adenomyosis, that is a generalized swelling of the uterus, which is generally seen post 40. Or you see the fibroids, which are more in number or which are larger in their size. You could also look out for endometriotic cysts in the ovaries. So these are the parameters on the 3D ultrasound, which if are present and you have done good cycles of an embryo transfer, you might think of surgically removing them or medically taking care of them before you embark onto the next round of embryo transfer. In these miscellaneous factors also comes the second spectrum, which is autoimmune. So basically, have you ever wondered that the baby which has got a completely different genetics, which has got a completely different DNA, grows very well for 9 months in a mother's womb? Why does the mother's body does not take consider that baby as a foreigner? Because that's a natural mechanism, that there are certain immune factors in our body which recognizes the baby as self and allows the baby to grow for 9 months. But in about 1 to 5% of women, there are antibodies which will keep on affecting the growth of the baby or which will prevent the implantation. So in these given situations, you can see either implantation failures or miscarriages. So there are certain kind of blood tests that are available to look out for autoimmune factors. And if any of these factors are positive, then the doctor might give you some therapy like ecosprin, heparin to improve your implantation before you go ahead with the next embryo transfer. And these medications can continue for a little longer duration during your 9 months of journey. The third factor, which nowadays is also into picture, is other immunological factors, wherein we do immune testing just to see is the mother rejecting the baby and taking the baby as a foreigner and not allowing the baby to grow in terms of miscarriages, or there is an implantation failure. Again, in these parameters or in these given situations, there are treatment modalities that are available in case you test positive for these immunological factors. And the last of all is that you have tested for these all things. You have done a genetic testing of the embryo, you've done the genetic testing for endometrium, good 3D scan shows nothing. All immunological parameters are under control, but still another round of an embryo transfer goes into failure. These are unexplained situations wherein you might try adjuvants. So, when I say adjuvants means that they will improve your implantation potential, but they will not control the implantation potential to 100%. So, things like using of GCSF installation in the uterus, or platelet-rich plasma installation in the uterus, or even thinking of techniques like laser-assisted hatching. These are few things that your team, your doctor or your embryologist might do to improve your implantation. So, my dear colleagues and my dear friends, what I want to say is that yes, fertility becomes a very painful journey, and then having embarked on an IVF journey, encountering these recurrent implantation failures is mentally very devastating. But then now the science is so advanced that you can look out for advanced factors. Don't lose your hope. Keep in touch with your doctor. Get, if your doctor advises some tests, please go ahead with these tests because they carry a lot of importance. They can improve your pregnancy outcomes, and we have a way forward for each and every problem that you encounter. With this, now I'm open to any questions that you have, and we can take it. So, my dear friends, in the end, I would just want to say that when science meets hope, miracles do happen. So, never lose hope. And with this, I conclude my session. However, if you have any doubts, you please feel free to connect with us at Apollo Fertility. Thank you and have a fantastic week ahead.